All right, ladies and gentlemen, this is Dr. Michael Kay from the Center for Functional Health, and tonight I am honored to have Cass Nelson Dooley on the line with me tonight. So thank you, Cass, very much for coming out.
Thank you.
Absolutely loved your book, hence why we're speaking tonight, Healing the Oral Microbiome. When I was telling patients, this is what I'm reading, like, what is that? I don't even know where to begin. So everyone's so used to hearing that the microbiome in relation to the gut, but when it comes to the oral microbiome, they're like, I didn't even know. So thank you very much for taking time out of your busy schedule. I know you do a lot of work, so thank you for joining us tonight. And to start, give us some of your background. You got a very cool background, so I hope you don't gloss over something that I think is really important. And if not, I'm going to bring it to you. So if you can share your background, that'd be great.
Okay, wonderful. And thank you so much for having me. It's wonderful to be here, and I honor your work too. I'm excited about everything you're doing to make the world a healthier place too. My background, I did an undergraduate and graduate degree in ethnobotany and ethnopharmacology. So I was really interested in medicinal plants from the get-go. I did some research in Panama, Fulbright research, and I eventually ended up at a laboratory in Atlanta, Georgia, Metametrix Clinical Laboratory, which was a cutting edge laboratory in functional medicine. So I started out in the field as a medical educator, and then the company was bought by Genova Diagnostics. Many of you may have heard of them. And so it's been something like 15 years that I've been in the functional medicine world, and I just love it. I love thinking about disease from the root cause perspective rather than just treating the symptoms. That's something that just kind of comes naturally for me, thinking of things that way. And I don't know if you want me to explain how the book came to be, but basically, through functional lab testing, I was very knowledgeable about stool testing. And I was approached by a company to write a paper on the oral microbiome, which, I just jumped at the chance because it was such a neat, kind of a natural step away from the gut into, the oral microbiome, what's there, what's this new frontier? So it started with a paper, and then that took off, and then people wanted to learn about it. It was such an exciting topic. And then eventually I was approached to write a book by a publishing company, and that's how we got to be here today.
Excellent. And again, as I just said to you before we hopped on, I really loved how you took a very complicated subject and made it very easy to understand. And that was absolutely wonderful. And again, as I showed you, I dog-eared the pages and highlighted, and we're not going to go over every single highlight, but I think there's some great important things to really talk about tonight. There is maybe just people don't understand and misunderstanding of how the oral microbiome is connected to the gut, but more so connected to disease. And I think that's important to talk about tonight. So before we go on, we're talking about microbiome, but some people maybe not understanding very well microbiome, microbiota, and bugs. So if you can just give us a rundown and set the tone for what is the microbiome?
Sure. So the microbiome is the collection of organisms that inhabit the human body. Let's say the human microbiome is the collection of organisms. So I think primarily we're talking about bacteria when we think about the microbiome, but there can be fungi, there can be bacteriophages, there can be viruses. There's a lot of microbes that colonize our bodies, all the surfaces, the gut, the mouth, really everything you can think of. I think it's potentially colonized by microbes. And in fact, the combination of humans with their microbiome is sometimes termed a superorganism, because we really are not just human cells. We are human and microbial cells working together. So that's the microbiome.
And the microbiota.
And the microbiota, right. So I think microbiota, I tend to think that is bacteria. I haven't checked I tend to think microbiota are generally bacteria, but I could be wrong about that.
And there's different types of microbiome as well, right? So, I've been reading about there's an eye microbiome, there's a vaginal microbiome, there's a lung microbiome, there's a brain microbiome, right? So we're reading more and more about the brain-gut axis and how important that is. And these microbiomes, these communities, if you will, are important. And, in any good community, you can have some good neighbors and you can have some bad neighbors, and you want a nice balance. And it's never, one thing. And that's what I get from a lot of patients. They're like, well, how can I make everything nice and even, and I'm like, it's not. The microbiome is fluid. I mean, it's ups and downs. So it can't be just one thing. And when we talk about microbiome, we often talk a word we call dysbiosis. Can you talk a little bit about dysbiosis, both oral dysbiosis and gut dysbiosis?
Right. And, most of what we know, I mean, most of what I know about the mouth anyway, started and we learned from the gut. There's so much more research on the gut, including the gut microbiome. And dysbiosis is a pretty established term now. I'd say when I started in functional medicine, it wasn't all that established. It wasn't something you'd come across in like a paper, but now you will. And dysbiosis is just an imbalance of bacteria that might cause symptoms or illness in the host. So it's just an imbalance. We can't really say. One thing that's always tricky with dysbiosis is we don't know what the perfect microbiome is. We don't even really know what a healthy microbiome is because it's very different for different people, depending on what they're eating, where they're living in the world, who their parents and grandparents were, et cetera. So we don't know what the optimum is, but we can say that there's dysbiosis when someone has symptoms as a result of an imbalance in their microbiota or their microbiome.
A lot of times people feel, well, if I just take a probiotic, then everything will be all okay, right? And maybe I just need 2 probiotics. Maybe I need 3 probiotics. Maybe, I need, Espelarti. Maybe I need, more lacto. And I find that when people hear they have an imbalanced gut, they just go out and they buy the latest and greatest, whatever probiotic is being marketed at the time, often thinking that, well, my God, 50 million CFUs, colony forming units, that's got to be better than 30 because 50 is greater than 30. When your microbiome, when your gut, you may not need that. And there have been many times where I've either taken patients off of probiotics and they felt better, or we just got them a different kind, right? So I find that, when people, if you give somebody an antibiotic, prescribe an antibiotic, it's not working, they prescribe another antibiotic. But a lot of times patients are like, well, that probiotic didn't work, so therefore all probiotics don't work. And that's necessarily true. And again, like you said, it depends on each individual and their own gut. You had a section in your book, I wonder if you can talk about it. It was all about saliva.
Yeah.
So how important saliva is. I'm like, this is great. We really went to town on that. So can you talk about the importance of saliva? Now that I'm
sure.
Oh my God, it's that saliva is really.
I know. So suddenly everybody's like salivating.
Right.
Yeah. So, I mean, me too. I was so surprised. This extremely important part of the oral microbiome and of a healthy mouth. I think anybody who experiences dry mouth knows how important it is for a healthy mouth. So even though we might feel annoyed by saliva or, it's gross or whatever, it's totally critical to a healthy microbiome. So saliva is full of healthy things for the microbiome. It has nutrients. It has food, essentially. It has immunoglobulins and immune factors that keep control over the oral microbiome so it doesn't get out of balance. Actually, even, I talk in the book about the sea of saliva, but even just the kind of mechanical motion of salivating and swallowing, that kind of constantly keeps things moving, constantly washing off the surfaces of the mouth and, kind of challenging the microbiome, like what sticks, what doesn't stick. So if you get dry mouth, you are going to have an unhealthy it's easier to have an unhealthy microbiome. It really changes the whole environment, the whole landscape for these microbes to live. So,
and you can see it when we have patients that come in and on medications that cause dry mouth, like Elavil has been around, a long time, amitriptyline, but and it has great benefit, but one of the problems with that, it does cause dry mouth. So you often see that when patients are taking several medications that they now have a dry mouth problem. They're taking several medications, they got the dry mouth problem, then they got the gut problem.
And my dental hygienist recently told me that it's just, there's so many medications now that cause dry mouth as a side effect. She can't even keep up with them all.
Right. Right. So it's, that's super important. So for somebody that has dry mouth, I mean, I don't want to say, drink more water because they're drinking water. I mean, that's great. And they should drink water. But sucking on hard candy isn't going to help them either. So is there something that somebody can do to help increase their saliva? I mean, other than just, hey, drink.
Yeah, I mean, the options are not as good as we would hope, honestly. There's kind of, and I'm not a big expert in this either, but I mean, like you said, there's chewing, there's certain hard candy, there's, maybe xylitol gum, there's different, mechanical things you can do. There is like a artificial saliva that people can use. I've heard it's kind of gross, not that great.
I've heard too.
Yeah. I mean, really, one of the things too that I think about is trying to get to the root cause of those illnesses so that maybe the medications can be helped, or if it's an autoimmune disease that where dry mouth is a side effect, working on those root causes. I mean, that's something that functional medicine, has that wonderful strength to be able to try to address those things. I mean, and certainly too, like for instance, I had a woman contact me about dry mouth due to radiation after cancer treatment. So, I mean, that's just very hard to, change that. But I mean, perhaps treatments that focus on healing the oral mucosa and trying to heal some of the glands. I mean, again, it's focusing on trying to heal the organism and hopefully the salivary production can improve, but there's not as many options as we would hope.
Right.
Yeah. It's a tough one.
The saliva, you mentioned, the immune system. So the immune system is really important. And of course, everybody's interested in their immune system now. I mean, in our current state, all of a sudden, everybody's interested in their immune system. So you did a wonderful, again, explanation on the adaptive and innate immune system. So
thank you.
You share how your explanation in your book, how you see the adaptive and innate immune system, why it's so important as well.
Sure. And that was the hardest part of my book. The immune system. Thank you so much. It's a tough one. So, I talked in the immune system chapter. Well, it is so important, right? And basically one of the take home points of that chapter is that right there in the mouth, the immune system is working really hard. And it's at the mouth is where we're first coming into contact with the outside environment, the food, the water, the toxins, the allergens, the pollen, all of these things that come into viruses, right? So the bacteria, parasites, the mouth is at the front lines. And so the immune system, we have two different, kind of sides of our immune system. One is the innate immune system, which is kind of an ancient immune system. And the other is the adaptive immune system. So the innate immune system is responsible for kind of mechanically protecting us from bad guys, right? So just the barrier, just the lining of our mouth is a innate immune protection. Try, kind of put a wall there and try to keep bad stuff out of our bloodstream. And then it also can go after, immune killing macrophages and things like that can kill bad bugs. They're trying to invade the body. Well, the adaptive immune system is the part of our immune system that has a memory. And so this is where T cells are involved and B cells are the ones that make antibodies. So again, it's like this is the slower part of the immune system. And the body will, certain cells like dendritic cells will kind of reach out into the mouth and look for bad guys. And when they find them, they will kind of alert at all the other immune cells to multiply and go after those bugs. So that's where we develop, antibodies, and those antibodies can help if that microbe ever comes back. That memory lives now in the immune system and in the circulation and can attack, when needed. And one of the cool things, of course, is that you can up your immune cells or they can decrease based on what's needed. And all of this works in harmony with the microbiome in the mouth. So the good bugs in the mouth can up the immune system. They can suppress it until it's calmed down so that it's not overactive or harming the person. They can even tell the immune system to ignore them so they can live there, like good bacteria that want to live in the mouth. They can kind of, like certain strains of streptococcus can just say, like, don't look at me, ignore me. And the immune system will ignore them. And then good bacteria help improve T regulatory cells, which are really important for controlling the immune system and regulating it so that it isn't overactive. And when those T regulatory cells are out of commission, when they aren't working properly, we can develop autoimmune conditions, allergies, asthma, et cetera. So, when we talk, I'm sure you talk about this a lot with your clients, Dr. K, but, when T regulatory cells aren't empowered, then often there's an immune system problem. Right. So the oral microbiome really helps encourage Treg cells and a balanced, healthy immune response.
Excellent. Yeah, wonderful explanation.
Thank you.
Great. So, you talked about that the immune system and the saliva is really important. And we've read that the immune system, like 70-80% of that's created in the gut, correct? That's what we often read. We know with secondary immunoglobulin A, IgA, and all that's important. So you had a great title. So this is our lead, segue into the gut. Kissing Cousins. I thought that was a great title. Yeah. So can you talk a little bit how there's this gut-oral connection? And this is really
Yeah. I mean, it's almost funny that we don't assume there's the gut-oral connection, right? Because I mean, these are just two places on the exact same tube. I mean, yes, it's a long tube that goes through the whole body, but these are connected. And it's, as I started studying it and looking deeper into it, it wasn't really surprising to find out, okay, we talk about the gut lining when we talk about the gut, right? Like a healthy gut lining. Well, we've got the same thing with the oral lining. We really need a healthy oral lining. And they're very similar, only the one in the gut is much more thin, and the one in the mouth is a little more dense, just a little more dense. They're both, the lining of the mouth and of the gut are fragile, however. So we have to be concerned about gut, permeability of that lining. The immune system, like you said, the immune system in the gut, it's called GALT. In the mouth, it's called MALT. Is it GALT? I'm blank. I think it's MALT in the mouth.
Yep.
Yeah, it's not. I mean, they're both, and then there's NALT in the
nasal associated lymphoid tissue, and
right,
yeah,
right.
Yep.
Exactly. So, so the immune system is set up in exactly the same way. The same immune cells are working in the mouth and in the gut. We have immunoglobulin A, like you said, in the mouth and in the gut. And in fact, I read a paper that showed that when it's released in the mouth, it signals to the gut. It's kind of telling the gut, hey, be on the lookout. This is coming down the pipe, Gosh, and then the microbiome. Now, the gut microbiome is many more cells, right? There's trillions in the gut, and there's something like, it's estimated something like 20 billion in the mouth. And so, but the mouth, the diversity of the oral microbiome is second only to the gut. So, I mean, these are very like neck and neck microbiomes, so to speak, in the human body. Am I missing anything? I mean, we talked about immune system and the lining and the microbiome,
right? So let's talk about the lining, because then we can talk about leaky gut, right? Leaky gut, leaky mouth, right? And bacteria. Right. I mean, that's important when those proteins and the bacteria seeps into those linings. So that's why when somebody comes in with their gut, I'm like, all right, and how's your mouth? And what? I'm having gut issues. And I'm like, and how's your mouth? So that's why one of the things that we look at in the clinic is, what's the dental history like? And we actually look inside the mouth, and looking inside the mouth, and we'll get to this in a moment or so. It's absolutely amazing what you can find. I think everybody over the age 40 and above got to have a periodontal visit. That's just part of being healthy, right? We all accept your colonoscopy. We all accept that, there's mammograms that need to be done. We should just accept, we should have a periodontal visit. I think it's because
That's really interesting. That's really interesting. So in addition to the normal cleanings and things like that, you think it should kind of be, hey, you turn 40, your periodontal risk is higher and you need to have it checked out.
Right. At least, and
That's
if you
cool.
go, and at least if that baseline, you get your baseline, that baseline is what they would consider normal, at least you have that baseline to start. Because one thing you don't want to have is your teeth to start going, your gums to start going. And listen, looking at the tongue is extremely important. So, we have some patients who are dentists and patients who are dental hygienists, and it's amazing what they can find when they look inside the mouth. So, that periodontal disease can lead to other diseases.
Right. And many other diseases. I think that's such a neat idea. And I do love to hear about what you're seeing in the clinic. I'm so glad that you are asking about the mouth and really looking at the mouth. I talk to clinicians a lot on the phone when I'm going over stool test results. And, there are clinicians that are really thinking about the mouth because they're connected like we're talking about. You can't really talk about the gut health without talking about oral health, but not everyone has it as part of their intake. And certainly, I think it's more common that dentists aren't really in touch with their patients' systemic health. They don't really know what's going on with the rest of their patient's body. And then primary care physicians aren't really checking their patient's mouth or know about their dental health. So there's a real disconnect when we think about, whole body medicine.
Yeah. One of the questions they ask on the intake forms is, do you floss? Do you brush your teeth? And they seem to be like two regular innocuous questions, right? Of course you do. But the answers we often get is no. Right.
Wow.
So, okay, well, all right. Or I brush my teeth and I don't floss. All right. Why don't you floss? Because it's sensitive. I'm inflamed. Right?
Oh, yeah. And then you've got a clue.
Exactly. We can have a patient has, Crohn's, and they can have that inflammation in their gums. Right. So they can't floss. Now, some people's technique for flossing isn't great either. Right. So you don't want to saw. A lot of people like put it in there and they start sawing. So you got to scoop. So that's really important. That's why we'll move into like a water pick. Because we want that bacteria out there. Because as long as the bacteria hangs around, the more problems that can occur.
Sure.
So if we can talk about what you found, what you share in your book about that bacteria that's hanging around and how that could lead to cardiometabolic dysfunction.
Sure. Yeah, it is. One of the most exciting things about the oral microbiome is how it's connected to so many other conditions, right? It seems kind of surreal, right? It's, an unhealthy oral microbiome has been associated with Alzheimer's disease, so the brain, rheumatoid arthritis, the joints, cardiometabolic disease, the heart and cardiovascular system, diabetes, preterm births. The list goes on. A cancer, it goes on and on and on. So I think we really have to start paying attention to the oral microbiome. So what, in terms of heart disease, there have been a lot of lines of evidence. The evidence is actually really strong. I would say of all the conditions that we associate with periodontal disease or, gum disease, is heart disease. It's the most obvious and well-supported link in the literature. Now, how it works, we don't exactly know. Is it? So let me just, for everyone who's listening, I think everyone understands gum disease, but let's just do a quick explanation here. This gum disease is basically a dysbiosis, so a bacterial imbalance that triggers an immune response, a vicious immune response, I would call it, that destroys bone and ligament in the mouth. So teeth can fall out as pockets, as the gums get kind of loose. Now more bacteria and unhealthy bacteria, bad guys, can grow and create more infection. And so it's kind of a vicious cycle. So when all of this is happening in the mouth, you have to think that there is a blood supply going straight from the mouth, straight from the jaw, right into the heart, and into the veins and capillaries. And it's not just the microbes in the mouth that have access to the circulation. It's also all those inflammatory cytokines, all those kind of, damaging molecules that are creating damage in the mouth. So, one hypothesis is that all this inflammation and all these bad bugs in the mouth get into the circulation every time you brush your teeth, every time you eat, every time you go to the dentist for a cleaning, every time you get a dental procedure done. Those microbes and that inflammatory process gets into the systemic circulation and damages, causes damage, causes atherosclerosis. Another hypothesis is that it's actually the bad bugs, the pathogens in the mouth that get into the systemic circulation and damage the arteries, like literally kind of nicking and damaging and creating, plaque and clots that can then lead to eventually, maybe a stroke or a heart attack. And in fact, it's not such a crazy idea because they find these pathogenic microbes in the plaques that, and especially the ones that are more likely to rupture, the ones that are more dangerous, they find these oral pathogens there. So I think, does that answer your question? Was there anything I'm leaving out there?
Nope, that was great. And you talked about it in your book as well. You said, listen, pathogens can play a role, but you're not saying pathogens is a direct correlation, right? So you talked about how, we still have to look at, what you're eating, your lifestyle and all that. But my gosh, if something as simple as brushing your teeth, as flossing, as seeing your dentist, as going to the periodontist, there are just so many simple things that you can do that can help you, right? It's all part of prevention. Nobody really thinks of oral as part of prevention other than a dentist, right? And then that's what, maybe people see it once a year, twice a year. I see my dental hygienist 3 to 4 times a year because I think that's really, really important. And you were talking about the heart. So let's talk about one of my favorite markers that I perform all the time that a lot of my local docs do not. And that is HSCRP, right? The high sensitive C-reactive protein. And most of the reply is like, it really doesn't matter, right? So I always try to explain that, it is highly sensitive. It's not highly specific. So if you have elevated CRP, of course, I'm concerned about the heart, but we have to look at other things that can be causing this inflammation. So if this is present, I just don't want to throw it away and say, okay, well, your lipid panel looks great, and you had an echo, and that looks great, and you had a stress test, and that looks great, so we're just going to ignore it. I don't think we can ignore it. So if we can talk a little bit about CRP and why that's important.
I'm a huge fan of CRP too. I love CRP. And I feel like everyone should be getting it as part of an annual exam just for monitoring health. It is a excellent marker of systemic inflammation. And like you said, it doesn't tell us what's causing inflammation, but if you have a raging fire in your body, basically in your blood, you want to know about it as soon as possible so you can get to the cause of it. And so that is what CRP is. It's a great marker. There's tons of research behind it. And every doctor should be running it, on everybody. Of course, they aren't, like you said. So,
and it's inexpensive. It's not an expensive marker to run.
Right. Now, one of the top reasons you can get high CRP is a infected root canal. Infections are a cause of high blood CRP. And so infections that are hidden in the mouth, and people don't have to know about this. You don't have to have a toothache. You don't have to, feel pain. You might not even know it's happening.
Right.
So it's one of the things Mark Berhena is Ask the Dentist, and he has a form that people can take to their doctor and to their dentist, where the dentist and the doctor can kind of collaborate on this marker and on dental health and how it might be relating to CRP. But it's one of the top, potential causes of elevated CRP. So I think it's now when CRP is above 3, cardiovascular risk goes way up. So we want CRP to be normal, and in order to have good heart health.
And I've seen it way above 3.
Right.
And the reply was like, don't worry about it.
Yeah, that's scary. That's scary.
It's very scary.
Because it should be, the response should be, okay, we have to get to the bottom of it, whatever it takes.
Right.
How do we
don't get that.
Now, do you have you seen a lot of other causes of elevated CRP besides oral health? Have you seen
underlying inflammatory bowel disease?
Or maybe an infection in the gut potentially could. You're frozen for me.
Oh, there you go. It was buffering. Yeah, we had a patient had bled, so I mean that was there was some elevated CRP there. So yeah, I mean you have to kind of dig deep. Of course, listen, the first goal is rule out pathology, right? So let's go to the heart and make sure everything's okay. And once we get stamp of approval, and then we got to go searching elsewhere where it's at if it's not located in the heart. So yeah, I think it's an important marker. It's an inexpensive marker. It's a marker, that by itself should raise an eyebrow. But I think when you look at it in the setting of the whole picture, the remaining markers, along with the clinical presentation, you have a story to tell then. So I think that's really important.
Yeah, me too. I love it. And I'm excited, that you're doing it, and I'm excited that everyone's hearing. I think as, what do they call them? Like citizen scientists. Right. We all want to know about these tests. And if your doctors aren't running them on you, then you have to tell them to run it.
Right. And it's okay to ask, I mean, most doctors are open, I think, if you ask them. But a lot of times that's where I do a lot of the legwork for my patients and make sure that their doctors understand what's going on. So, I try to bring everybody in as a team approach, right? So I believe all my patients should have a team, so everybody knows what's going on, and this is how we move their health forward, right? So everybody gets their own team. I think that's super important. So let's talk about some strategies. So you talked a little bit about toothpaste. You talked about mouthwash, right? Like, can we just get any old mouthwash, right?
Oh gosh, yeah, we got to be careful with mouthwash because mouthwash can kill the good bacteria in your mouth.
But we're minty breath, so what can we have? I mean, we just ate a can of sardines, so.
Yeah, when you got all that good fish oil, right?
Yeah, I mean, eventually we're going to come out of our mask, right? Right now everybody eats sardines to stay in mask. Now see how tough you actually are. But, what kind of toothpaste, what kind of mouthwash should we look at?
Sure. So, I mean, we do have to watch out about toxic. Well, first we have to watch out about toxic chemicals in our oral health products, right? These are not very, to me, what I can tell, they're not very well regulated. So it seems like people can put a lot of different things into these products that they shouldn't be there. But in terms of mouthwash, you don't want alcohol. You don't want things that are drying. You definitely don't want chlorhexidine mouthwash, and that's really more like a antibiotic mouthwash, but that kills good bacteria. So when it comes.
All right, folks, we're going to just give her a few minutes here to see if she actually comes back. All right, there you go.
I think I may have lost signal.
Yeah, we did. We dropped it up a little bit.
Okay, sorry about that.
Okay.
Where did we leave off?
You were talking about what kind of mouthwash that's important to have, and what we want to do is avoid taking something or swishing with something that can actually kill our good bacteria.
Right, exactly. So, I mean, we want to watch out for toxic products in our dental health, toxic chemicals in our dental health products. And I've seen that you have a good little handout for guiding people, your patients, to like what. It's a functional medicine handout about what to avoid in those products. But in mouthwash, we want to watch out for alcohol. We want to watch out for, again, chemicals that don't belong there. We want to watch out for chlorhexidine. That is basically an antibiotic mouthwash. that kills kills bacteria. Really, I'm okay with wanting to freshen your breath. Just go easy on the bugs because we like those good bacteria and we don't need to kill them all. I do think some essential oils are okay, but I think we have to be a little mindful that certain essential oils can kill good bacteria too.
What about xylitol? Yeah, I was going to ask, what do you feel about xylitol?
Oh yeah. I love xylitol. And the only thing I guess is, that people who use it as a sweetener are still kind of hooked to that sweet taste. So just that would be the only, in the kitchen to watch out for, with lots of staying with sweets, right? Because that is the hope, is that we would all eventually get off of them. But yeah, I think swishing with xylitol. I haven't researched, swishing with like peroxide, diluted peroxide and things like that. But I'm imagining that a diluted peroxide might be okay. Do you know much about that?
No, I know a lot of people switch with coconut oil. They'll do the coconut oil.
That's good. Yep. Oil pulling. I think oil pulling is a solid intervention. Mm-hmm.
And then, what is the name of the toothpaste? It's I forgot. It's like black toothpaste. I forgot what it has in it that helps to scrub.
Mm-hmm. Charcoal, not the charcoal toothpaste.
But I found that, so I experimented because I biohack myself. Right now I got one of these, continuous glucose monitors in there. So I did the charcoal thing, and I found that it was starting to affect the enamel. Right. So you're
100% right. I have heard of that complaint.
Right. So you have to be careful. So again, just like the microbiome of the gut is different, so is everybody's oral microbiome, right? So I think some people can get away with it and some people can't. Just be careful. And what's the other chemical? Sodium?
Yeah.
Is there another chemical?
Sulfate. Mm-hmm.
Yeah, sodium or sulfate.
SLS, that's foaming.
Right.
There are chemicals in toothpaste that literally cause, ulceration in the mouth. There's a lot of chemicals that we do not want in our bodies that are routinely put into toothpaste and mouthwashes and things like that. Now, I have heard that the charcoal is not the greatest. So, I'm not an expert on this. I like Risewell products. They have some neat oral health products. Designs for Health has a periobiotic toothpaste, which is kind of neat.
Big fan of them. We lost you again. There you go. Come on back.
Adding basically RNA. Oh, I'm here.
Yeah.
Can you see me?
Yep. All good. Yeah, I think Design for Health is
okay. Good. Thank you.
As well. Yep, I like Design for Health products as well. I think it's really good. So I got a question.
Chewable probiotics.
Yeah, chewable probiotic is great. You were in Panama, right?
Yes, I was in Panama.
So, what was one of the things that you really took away from Panama? What were one of the magical things you really learned there? Because not everybody gets that opportunity to.
Well, gosh, no, absolutely. What's coming to mind first? I got a lot there, but and you can hear me okay right now? Can you hear me?
Yes.
Yeah. Okay. What comes to mind first was I studied medicinal plants with Afro-Caribbeans and with indigenous people, Native Americans from Panama. And the Afro-Caribbean group was very interesting because, they had a whole botanical medicine system that was very well known. The old people knew the herbs and the little children knew the herbs that were good for healing. And I really, it just kind of reinforced how important that oral tradition and teaching the younger generations is in our super, kind of westernized society. I worry about what gets lost, the knowledge that gets lost. But both communities had lots of medicinal plant use, but the indigenous people really relied on their curandero. Really, they relied on their shaman to do all the healing. And it wasn't a community kind of involvement. Whereas in the Afro-Caribbean group, really everyone, there were people that knew more, but almost everyone knew a lot. you know,
Very
and a
cool.
lot of teas, plant medicinal teas it was all about that. And I think we could benefit to do the same thing. Lots of medicinal plant teas, just drink them all the time.
Right. I agree. I think there's a lot of great content to learn from these indigenous tribes. I think we've gone so far away from what we could do to help ourselves. That would be a cool next book. I think what you learned there, I think that'd be pretty cool.
Thank you. I know, I do think about that.
Yeah.
Oh, thank you. I needed that little suggestion there.
Good.
And let's just tie that into the oral microbiome too, because I was just going to say, sorry, I think we're having a little trouble with signal and there may be a delay, but medicinal plants for oral health, there's a lot of them out there. I mean, neem is really famous. But nutrients for the oral microbiome like vitamin C and minerals and B vitamins are so important for the gums, health of the gums, CoQ10. But back to herbs, flavonoids, carotenoids, all the things that are in polyphenols, all of the things that are in vegetables and fruits are so good for our good bacteria. I even read a study today that said that drinking regular oolong tea was really great for the oral microbiome. So I don't exactly know the mechanism there, but
I
plants
agree.
and medicinal plants are
Really important. What do you feel about bergamot?
Go ahead.
Bergamot.
I don't know that much about it. You tell me about it, please.
Yeah.
Because I mean, I know it's used to lower cholesterol.
Yep. Lower cholesterol. And that's one of the main things that they use to help lower cholesterol. I love berberine. Berberine is another one that's great. Berberine is great for blood sugar control, great for the gut as well.
Absolutely.
I agree with you. I mean, there's a lot of things you can do.
Yes.
That's simple. That's easy. But we also want to be cognizant of plant medicine as well, because if you're taking a medication, it may be contraindicated, right? So that's really important. And certain liver problems wouldn't do well either. Oh, we just lost her. Let's see if we get her back, folks. We'll give her a couple seconds. There we go. Can you hear me okay?
Yes, I can. I think we are having some internet connection issues tonight. I'm sorry.
Don't be sorry at all. This has been great, right? So we were just talking about the importance of plant medicine, but there may be indications with certain medicines you're on and your liver and stuff like that. So we're going to be cognizant of that as well. That's important to take a look at. All right, so let me ask you this one question, and we'll
right.
I thank you for tonight. Tonight was great. I really appreciate it. So here's a question. Ready? What is the one book that you read that really helped you move your health needle forward?
Tell me again. It came through slow, the question.
What is the one book you read that really helped you move your health needle forward, that really said, wow, this is really important? It's a great book that really improved my health.
Ooh, that's a good question, Michael.
Because I know you read a ton of books.
I mean, well, I feel like I've read a ton of papers. I don't know. You're stumping me. Let me see here. I've got my. Yeah. Let me think of a. You know what? I mean, gosh, this is old school. This is old school. One of the papers that just made a huge difference for me in my learning over the years, there was a paper about the 10 mechanisms of cancer. And, it just was a game changer for me.
Well, ladies and gentlemen, we keep losing her. Unfortunately, she must have a bad connection on her side. I wonder if there's a storm or not. I'm going to see if we can get her back. There you go.
Hi again.
That's all right. You're talking about the paper.
Yeah. So there was a paper on the 10 mechanisms of cancer and how it's develops, and that was just a landmark paper for me understanding cancer, and just just going through the big lifestyle changes that it takes to really live try to live a cancer prevention lifestyle. But I mean, I'm gonna have to like email you later with an answer. I feel like I feel like I need to really think about that one. I think you stumped me on this one.
That's all right. Well, again, thank you very much again. And again, your microbiome, right? So if you can tell everybody where to get it, that'd be great. All right. So here, folks, you can go to her site. Just look up Cass Nelson Dooley. And you can also take a look at what she does and her book as well. We're having some connection problems. So everybody, thank you for watching and hope to see you in a couple weeks. Take care.